We're here with the Pink Drive that is going to initiate some screenings, cancer screenings here in Johannesburg. I mean, it's been over a decade of the Pink Drive really giving out these services to communities. Perhaps tell me about some of the gains that you've achieved over the years.
As you mentioned, we've been going for over a decade, and this is all thanks to corporate South Africa, other philanthropic organizations, international government organizations, as well as the public at large, to raise funds to take the much needed cancer screening, and in this instance I'm talking about mammography screening, to all the medically uninsured across the country. We know that government cannot do this on their own, and therefore, it's really all about collaboration. It was the communities that actually put the pressures on us to start looking at cervical cancer screening. We do PSA screening, but we've even broadened it by partnering with other health organizations, because the communities are in dire need of health services. We worked very hard last year. We raised over 3.7 million in less than 6 months. We now have a state-of-the-art 3D machine that is going to make a huge difference.
I'm going to try and speak to the Minister while he's on his walkabout as he is engaging with some of the stalls. Minister, perhaps maybe take us through how you as a department feel about these kinds of initiatives.
So we're very grateful for the partnership with Pink Drive, the screening of people who have any concern about possibility of cancer, so that they can be referred for treatment. It's useless if we're going to screen and they do the screening, they do the finding that somebody has early cancer, because the key thing is to find it early, and then we must have the facilities to make sure that such patients can be treated.
That is Minister Joe Phaahla, the Health Minister, talking to us about some of the initiatives the department itself is trying to put in place to also support initiatives like the Pink Drive. Has really come out in their numbers to take up this opportunity to get free cancer screenings, which are being sponsored by the Pink Drive. Of course, the Pink Drive has been doing these screenings for over a decade now, and I am joined by the Deputy Health Minister, Mr. Sibongiseni Dlomo. Thank you so much for your time. Of course, it does seem as though that the health department supports this drive. How will you be supporting this drive moving forward?
Pink Drive is doing what we were supposed to do anyway. But when they are here, we show our support. But there are other screening services that we are putting in here, HIV, TB. So we are coming in to want to say to them, thank you very much for identifying a place and many other places that we have been doing over the past 14 years, where you screen South Africans for detection of early cancers, especially the cancer of the breast, the cancer of the cervix. So the move is, let us prevent and treat early, because then it guarantees a long and healthy life for our citizens in the country.
So we've got various stalls, like the Minister said, that you can have your breast exam done here. You can have a mammogram done, which we know can cost up to 2,000 to 3,000 rand. And of course, we understand that the drive will be taking place in various other communities throughout the year.
We are here to support the Pink Drive and other stakeholders. This is part of our corporate social investment and responsibility, and helping entities like the Pink Drive extend medical health care to the communities that probably don't have the same access as others.
I'm excited that Pink Drive is here today, because it's going to make a very positive impact on our community, and it's going to help a lot of people that we couldn't get to. The community was very excited about it. However, they were very concerned if there's a cost attached to it. Like everything else, there's always a cost, and I think that limits our people to actually getting the help that they need.